Hello everyone, welcome to the YouTube channel Soulful Health with Dr. Rahul. Today we are going to discuss on the topic pleural effusion. Do you know what is pleural effusion? Pleural effusion means accumulation of the excess fluid in the pleural space between the visceral and the parietal pleural spaces. Usually we have normally 10 to 20 ml of pleural fluid in our fluid in our pleural spaces. It helps for the lubrication purposes. If the fluid exceeds more than 10 to 20 ml, then it is called as the pleural effusion. Do you know what are the causes of pleural effusion? Usually, it is two type of transudative effusion and exudative effusion. Transudative effusion, systemic factors, low protein, that can be all the failures like congestive heart failure, nephrotic syndrome, and it can be cirrhosis, mainly hepatic hydrothorax. What are the causes of exudative effusion? It is mainly infections. Infection like pneumonia, or it can be parapneumonic effusion, or TB. Next, it can be malignancy, either lung cancer, breast cancers, and lymphoma. Next cause can be pulmonary embolism, and other can be like autoimmune causes like rheumatoid arthritis, SLE. So, what are the pathophysiology of pleural effusion? Let's go for the transudative. In transudative, it causes increase in hydrostatic pressure or decrease in on decrease in oncotic pressure. Ultimately, it causes fluid leak. What about exudative? Uh, Exudative, we all know that is due to the infection, inflammation. So, firstly, it causes inflammation, which causes increase capillary permeability, and finally protein and cell leak. So how will the patient present to you with you? The clinical features are the firstly we will look for the symptom, what the patient tells you. The symptoms are mostly dyspnea. It is most common feature. Next can be chest pain. It will be like pruritic, sharp chest pain, and cough, dry, dry cough, non-productive. It means non-productive cough. What are the signs? The sign can be when we'll examine the chest, we'll find decreased chest expansion on the affected side. On percussion, we'll find stony dull On auscultation will found diminished or absent breath sound. Also, there will be tracheal deviation to opposite side. So, what are the investigation of the pleural effusion? First, we will go with the basic, that is chest X-ray. What we will find in the chest X-ray? There will be blunting of costophrenic angle. It is earliest sign. There will be meniscus sign, and in large pleural effusion we will find mediastinal shifts. Then we will go for the second investigation, that is ultrasound of the chest. It can detect a small pleural pleural effusion, pleural effusions, and it helps in the diagnostic and therapeutic thoracentesis. Next, we come to the CT chest. It helps to detect the causes like tumor, TB, pulmonary embolism. Finally, we comes to the main and the one of the important, that is diagnostic thoracentesis. In this, we send the pleural fluid for routine examination, like in routine examination will find all like GS, CS, QS, protein, LDS, cytology, glucose, AFB. Then comes the light criteria. This helps to differentiate whether it is transutive fluid or exudative fluid. In light criteria, there is three measure, that is pleural fluid, protein, and serum protein. If it is 0.5 more than 5, then it is trans exudative, sorry, it is more, it is, then it is exudative. Second, if pleural fluid, LDNs, and serum LDNs more than 0.6. These all are the criteria of the exudative fluid. Next one is the pleural fluid, LDNs more than two-thirds of upper limit of normal serum LDNs. If all these criteria meets, then we can call it as the exudative pleural effusion. Then finally comes is management. What are the management? First is management is treatment of underlying causes. Like if it is congestive heart failure, TB, malignancy, we can treat the causes. Next, we can do the therapeutic thoracentesis. In case it is the, if pleural fluid is high in amount or the patient is symptomatic, we can do the therapeutic thoracentesis. Then if there is empyema, we can have chest tube drainage in case of empyema.